Welcome to this training session on basic information about common medicines. In this video, we'll discuss their uses, conditions to be cautious of, food and drug interactions, and considerations for pregnancy. We'll also highlight how the MyHealth app supports continuous care and enables healthcare providers to make the right medical decisions. Let's start with two commonly used pain relievers, paracetamol and ibuprofen. Paracetamol. Paracetamol is used to relieve mild to moderate pain and reduce fever. Be cautious when dispensing to patients with liver disease or those who consume excessive alcohol. Avoid combining paracetamol with other medicines that contain it to prevent liver toxicity. It can be taken with or without food and is generally safe during pregnancy when used at recommended doses. Encourage patients to record any unusual symptoms, like dizziness or fatigue, in the MyHealth app. This information helps healthcare providers identify potential side effects and adjust treatment if needed. If paracetamol is being used for chronic pain, ensure the pharmacist sets medication refill reminders in the app after encouraging the patient to subscribe to this service. Ibuprofen. Ibuprofen is used for managing pain, inflammation, and fever. Avoid use in patients with peptic ulcers, kidney impairment, or hypertension. Be cautious when combining it with anticoagulants or other NSAIDs, as this increases the risk of bleeding. Always recommend taking ibuprofen with food to reduce stomach irritation. Encourage patients to use the MyHealth app to log symptoms like abdominal pain or heartburn for review by the pharmacist. For chronic use, remind pharmacy staff to advise patients to subscribe so their pharmacist can set reminders for safe and consistent dosing. Cold and allergy medicines like Pseudoephedrine and Chlorpheniramine provide relief but require careful monitoring. Pseudoephedrine. Pseudoephedrine is effective for relieving nasal congestion. Avoid use in patients with hypertension, heart disease, or hyperthyroidism. Encourage patients to note any side effects like increased heart rate or restlessness in the MyHealth app to ensure this information is available for their healthcare provider. Remind pharmacists to set usage limits in the app for short-term relief after patients subscribe to the service. Chlorpheniramine. Chlorpheniramine is used to manage allergic reactions and cold symptoms. Be cautious in patients with glaucoma, urinary retention, or prostate issues. Patients should be encouraged to record drowsiness or confusion in the MyHealth app, especially if they are elderly, to allow the pharmacist to make informed adjustments. Advise pharmacy staff to recommend patients subscribe to pharmacy services so pharmacists can provide consistent monitoring and care. Malaria treatment with Artemether/Lumefantrine requires strict adherence and monitoring. Artemether, Lumefantrine. This combination is used for treating uncomplicated malaria. Patients should always take it with a fatty meal to enhance absorption. Encourage patients to use the MyHealth app to log any side effects like dizziness or palpitations, and ensure this information is shared with their healthcare provider. Remind pharmacists to set reminders in the app for each dose to ensure full adherence to the course after patients subscribe for the service. Antibiotics like Amoxicillin/Clavulanic Acid and Metronidazole are essential for treating infections but require careful monitoring. Amoxicillin, Clavulanic acid, this antibiotic treats respiratory and urinary tract infections. Encourage patients to log any allergic reactions, such as rashes, in the MyHealth app to ensure timely intervention. If the medication is prescribed for a prolonged period, advise pharmacy staff to ensure the pharmacist sets reminders for refills through the app after the patient subscribes. Metronidazole. Metronidazole treats anaerobic bacterial and protozoal infections. Patients should record side effects like nausea or a metallic taste in the MyHealth app. This helps healthcare providers determine whether adjustments are needed. Use the app to set reminders for dose timing, ensuring adherence and preventing missed doses. Respiratory medicines like salbutamol and guaifenesin are critical for managing symptoms. Salbutamol. Salbutamol relieves bronchospasms in asthma and COPD. Encourage patients to use the MyHealth app to log symptom improvement, such as easier breathing or side effects like tremors. Pharmacy staff should recommend subscription to the app so pharmacists can set refill reminders and monitor usage patterns. Guaifenesin. Guaifenesin helps clear mucus in respiratory conditions. Encourage patients to log persistent coughing or changes in mucus consistency in the MyHealth app for pharmacist review. The app can also remind patients to drink fluids, enhancing the effectiveness of this medicine. Finally, medicines for chronic conditions require continuous monitoring and care. Nifedipine. Nifedipine manages high blood pressure and angina. Patients should use the MyHealth app to log blood pressure readings regularly, allowing healthcare providers to track effectiveness and make necessary adjustments. Remind pharmacy staff to encourage subscription so pharmacists can set refill reminders for consistent management. Lisinopril. Lisinopril treats hypertension and heart failure. Encourage patients to use the MyHealth app to log symptoms like persistent dry cough for pharmacist evaluation. Pharmacists should set reminders for medication refills after patients subscribe to the pharmacy service. Metformin. Metformin controls blood sugar in type 2 diabetes. Encourage patients to log blood sugar readings in the MyHealth app for review by their pharmacist. Ensure pharmacists set alarms for medication timing to help patients maintain consistency. Glimepiride. Glimepiride lowers blood sugar in type 2 diabetes. Patients should record symptoms of hypoglycemia, such as dizziness or sweating, in the MyHealth app for immediate pharmacist intervention. For long-term use, remind pharmacy staff to encourage patients to subscribe for refill and monitoring services. The MyHealth app is a powerful tool for recording symptoms, tracking medication adherence, and ensuring pharmacists can provide proactive care. Encourage patients to subscribe for reminders and consultations to enhance continuous care and safety. Through the Clinical Professional Pharmacy Services (CPPS) initiative, pharmacies can expand their role in patient care by offering pharmaceutical consultations, monitoring, and medication management. By leveraging tools like PharmCare and MyHealth, your pharmacy can improve patient outcomes while making money in a new way to increase the income of pharmacies. CPPS not only supports better health for your patients, but also positions your pharmacy as a leader in proactive, patient-centered care. Call or WhatsApp us on 0200-193-771. Visit our social media handles. Thank you for watching. Together, let's enhance patient care with knowledge and technology.